Hey guys, today we're going to talk about some medications that actually can affect your thyroid, causing hypothyroidism, where you're not producing enough thyroid hormone to keep up with what you should have in your daily functioning needs. First off, just a little background. The thyroid is a gland that uses iodine to make T3 and T4. It's not just one type of thyroid that you actually make. There are two types, main types that you're looking at. So that's something to be aware of when you're looking at thyroid supplementation through drugs like Synthroid or Armour Thyroid, because you may not be getting the correct one as well. The pituitary gland next to the thyroid actually will signal the thyroid through thyroid stimulating hormone, or TSH, which is generally when you're on thyroid replacement therapy, what they'll draw to check your blood levels. It will signal the thyroid through the TSH to release more of T3 and T4 to be released throughout the rest of the body to regulate things like energy, weight, mood, your general metabolism. Things like hair growth are affected by that as well, nail growth, the whole gamut of things is associated with your thyroid. So what happens, or what can happen, is it may not affect just your thyroid itself, but it can affect the pituitary as well. And there are several medications out there, and common ones, that you may not realize can be affecting your thyroid, which affects the body in numerous ways. The first one we're going to talk about, the first two we'll talk about, are methimazole and propylthiouracil. Well, you figure, oh Dave, those are easy, because those are actually used for hyperthyroid patients. They treat hyperthyroidism by decreasing the size of the thyroid gland, which then in turn decreases thyroid hormone levels, or the T3 and T4. So just so you're aware, that's what those are used for. You're not going to be on them if you don't have hyperthyroidism, but that's what the function may be. And even after you get off of them, it can take a little while to clear out. So just be aware of that. Another one which is much more common, especially in heart patients, is amiodarone. With that one blocks T3 from being formed. And it also blocks the signal from the pituitary gland to the thyroid saying, hey, we need more T3. So not only is it not getting formed, but the thyroid's not being told, hey, we got to make more. So you really need to watch out for that if you're on that heart medication. Mainly you'll see this in people that are older, or in people that have had a family history or a history themselves of having poor thyroid function. Now, notice I said that it blocks T3. A good patient that is on this medication that may need supplementation may consider Armour Thyroid as the drug of choice to use instead of just Synthroid. Another one that occurs is lithium. Lithium has an effect mainly on people with a history of hypothyroidism, and mainly in women over the age of 45. It will again lower your thyroid levels, and you will usually see it within the first 2 months of therapy of lithium. So honestly, before you get started on lithium, I would have your doctor check your thyroid levels, and then in a couple of months, see if they'll check it again, just to make sure you're doing okay on that. Because again, your thyroid is responsible for a lot of bodily functions, of which mood is affected. And lithium is a drug used to treat mood. So you don't want them counteracting each other. Interleukin-2, it's a cancer treatment. This one actually can cause thyroiditis, which is an inflammation of the thyroid gland itself, which can lead to hypothyroidism, which you would need to take thyroid supplements again. And by supplements, I'm meaning medications. Interferon alpha, another cancer treatment, again causing thyroiditis. It basically causes antibodies to the thyroid gland itself, which can really backfire and cause a lot of issues with that. Now, it's not a situation in most cases where you can get off the interferon alpha because it serves a greater purpose fighting the cancer that you're on. But you want to be aware of that. And most oncologists will check your thyroid levels on a regular basis because there are so many chemotherapy and cancer treatments that do cause decreased thyroid function. Tyrosine kinase inhibitors are another one. And again, that's another cancer treatment. But 40% of patients on those medications will eventually develop hypothyroidism. And then a real big one right now in the cancer treatment world is checkpoint inhibitors. And this is really occurring a lot because we're starting to use them a lot more, especially in combination, and they are having great success as far as knocking out cancer, as far as decreasing cancer treatment or tumor sizes. They're doing some wonderful things, but you need to be aware that these drugs can cause hypothyroidism, especially when used in combination treatment. There is a greater risk. The range is about 4 to 14%, and these are drugs such as Opdivo, Keytruda, and Yervoy, just to name three of the main ones out there. And then, of course, there is an old one, an older drug that used to be used a lot more, but really has fallen off. I can honestly say I might have dispensed it once in 30 years, and that's thalidomide. It too causes hypothyroidism. Basically, the cause is unknown. You know, there's a lot of other funky things that drug does as well, but you want to stay away from that one. You also want to be careful. There's a lot of pills out there for iodine. And yes, like I said, the thyroid gland uses iodine to make the hormones T3 and T4. And people use iodine to help prevent radiation poisoning. That's out there. For thyroid supplementations, I've seen it out there in a lot of different thyroid supplements. But you want to be very careful because too much iodine can also cause issues with your thyroid. It's a very fine line and a very delicate balance. So before you start using any iodine supplementation, talk to your provider or pharmacist.